Mrs. Smith is a 55-year-old female who was admitted to the ER 24 hours ago. She is obese with a classification 1. Her BMI is 30.9. Her current weight is 158, which is consistent with her usual body weight. She is 158% of her ideal body weight. She was admitted with a necrotic skin ulcer secondary to her type 2 diabetes on her left lower leg. She reports that her glucose had been in the 300s for the last 3 weeks or so, which is when she first noticed a sore on her foot. She didn't report it to her physician, and she presented to the ER because she was concerned about having an amputation required. Her past medical history consists of a T&E as a child. She's had no other surgeries to this date. She does have hypertension and neuropathy secondary to her type 2 diabetes, and she does have a significant family history of type 1 diabetes. Her medications consist of oral medications. Right now she's taking metformin 500 BID and glipizide XL 10 milligrams once a day. She does not currently take any insulin. Her doctor did recommend she begin insulin, but she did not want to at the time. Her food history indicates she eats restaurant food maybe 1 to 2 times a week. She does try to exercise at least once a week. Most of her meals she does cook, but she doesn't watch her portion size. She typically eats more than 1 portion at meals, and she doesn't watch how many carbohydrates she's consuming. Her labs indicate her glucose this morning was 201 fasting. Her recent cholesterol tests indicate just her total cholesterol was slightly high at 215. Her LDL and HDL were within normal limits. Her A1C was 9.8 about a month ago. For her assessment and plan, since the patient does meet the parameters for obesity grade 1, her ideal body weight was used to calculate her total energy needs, 22 calories per kilogram of ideal body weight, which gives us about 1,000 calories per day. She is recommended to increase her protein intake since she does have a wound that's trying to heal. So about 33% of her calories will be coming from protein, about 22% from fat, and about 452 calories, or 45% of her calories, will be coming from carbohydrates. Her diagnosis, her nutrition diagnosis, would be excessive oral intake related to compliance with diet and medication recommendations. For diabetes, as evidenced by A1C of 9.8, a fasting glucose of 201, and a BMI of 30.9. For her intervention and goals, Mrs. Smith is going to be put on a calorie restrictive diet, like I stated before, while she is inpatient, which is going to be about 1,000 calories a day, and she's going to receive a diabetic diet. Right now, she's not willing to receive any diet counseling, but I did stress to her the importance of following up with her physician and receiving outpatient diet counseling. We will follow up with her within 48 hours.